Doctors are researching a promising new treatment that could help take the trial and error out of treating PTSD. Spoke with some of those on the front lines of this research.
What we try to do is to do mental health assessments both before and after deployments. We've done about 600,000 of these assessments.
One intractable problem: how do you treat wounds of war that fester inside the brain? Now, doctors at Walter Reed Military Medical Center are trying a new system that shows promise.
It was actually life-changing for me.
Known as Central Nervous System Response, or CNS, it's simply a cap with electrodes worn during a 20-minute session to record brainwaves. The individual's brainwave pattern is then compared with a database to find which specific mood-altering drugs would likely be most beneficial.
Well, the man behind the company pushing this technology is with us now. George Carpenter, President and CEO of CNS Response. The cap I was wearing, standard electroencephalogram. It's been around for years.
Exactly.
But you found a way to take the information that comes out of it and help apply it. Can you explain that?
The company was created by doctors, and they thought that, you know, they've got 130 medications to choose from and no guidance on which will work for your particular brain.
So it's guesswork.
It is trial and error. That's the dominant therapy. And so instead of guessing, they said, let's see if we can collect data from the EEG that you took that correlates to medication outcomes of patients they already have. And it's now the largest brain database of its kind. And it improves 2 to 3 times the outcomes that doctors get. Yeah, those therapies.
Yeah, Dr. Richardson says it's 80% correct in his experience at finding medications that will help deal with, you know, the problems that might be inside the head.
Exactly. Everyone reacts differently to medications, and we want to know your brain. Psychiatry is the only area of medicine that doesn't have a test. So now they finally have something that they can do to objectively, rather than subjectively, figure out what's going to work.
We mentioned Walter Reed is testing it out. You guys are training some of the doctors there.
We've got to do a better job. You know, suicide rates, school shootings, junior SEAO, we see the results of treatment failure in mental health, and we just got to get better at finding new technologies like this and bringing them to the doctor.
It costs about $400 to take the test. Does insurance cover it?
The military will really be the first payer that's paying for this. United Healthcare has reviewed it, and looks like they'll approve it. So
exciting stuff, especially for our troops.
Thanks, John.